clenching of our teeth in a way that some people manage stress, they clench. If you do that chronically, that creates extra stress in the jaw. Now, from asymmetrical wearing of the teeth as we age, teeth misalignment, these abnormal bites or chewing on hard things or biting on something that's too hard, we can get trauma to the TMJ itself. Once that joint gets irritated while we're speaking and chewing all day, it doesn't get a chance to heal. And from the asymmetrical bite, the misalignment creates more and more mechanical stress. It's incredibly common when we evaluate people's bite that we go like this, we say, okay, open, close, that it's not symmetrical, that there's like a wag in it where it goes like this. Or if we open halfway and we go from side to side, then it moves asymmetrically. Remember that structure is related to function, and if the structure of the jaw and the teeth are misaligned, then it's going to affect the function, how the joint moves, how the TMJ moves, or if the TMJ moves incorrectly for a long period of time, it'll actually affect the structure. What we're looking for is nice balanced symmetry, and that's one of the great things that orthodontics helps us with, whether it's be old school braces or modern day Invisalign. By reestablishing better dental alignment, it can actually decrease stress on the jaw. But that wouldn't necessarily pull the curve back in the neck. So although we are big proponents of having patients get appropriate orthodontic and dental care, it won't correct the cervical curve. But if we correct the cervical curve and get better alignment, then we've got a much better chance of getting rid of the symptoms of TMJ.